Hello and welcome to Quinn's Harm Reduction Based Education. In this session, we'll look at hepatitis and more specifically, hepatitis C. We'll look at how Hep C is transmitted from person to person, and if you feel that you or someone you know may have been exposed to the virus, we'll discuss what kind of Hep C tests you can get done to determine whether or not the virus has been transmitted. We'll also discuss how Hep C can now be easily treated, and we'll look at what you can do if you feel that you may have been reinfected with Hep C. The term hepatitis is derived from the Greek word for liver, hepa, and the Latin suffix itis, which indicates a medical condition associated with inflammation. The virus, called the hepatitis C virus, or HCV for short, is just one of the hepatitis viruses. The other common hepatitis viruses are Hep A and Hep B, which differ somewhat from Hep C in the way that they are transmitted and treated. Hepatitis, or inflammation of the liver, can be caused by viruses like hepatitis A, B or C, or by substances that may be toxic to the liver, like alcohol. A main route of infections for Hep C is often through contaminated injecting equipment, such as the sharing of needles and syringes. About the liver. It's a large, meaty organ, about the size of a small football, that sits on the right side of the belly. The liver is reddish-brown in colour and feels rubbery to the touch. Normally, you can't feel the liver because it's protected by the rib cage. The liver works with other organs to digest, absorb, and process food. The liver is an important organ, as it distributes the nutrients from the food you eat to other parts of the body. It breaks things down, stores important vitamins, ions and minerals, as well as making vital proteins, glucose and fats. All important processes for a healthy person. There are many variations of hepatitis, and they are transmitted from person to person in different ways. There are vaccines available for some variants, such as Hep A and Hep B. However, there is no vaccine for Hep C. But new direct-acting antiviral, or DAA treatments for Hep C, means that it can now be easily cured in about 95% of cases. When someone first contracts Hep C, it can be quite common that no symptoms are experienced. However, after several years, some of the following symptoms may be noticed, such as poor appetite, flu-like symptoms, mood swings, dry mouth, feeling tired, muscle ache, generally unwell, liver pain, headaches, and not thinking clearly, aka brain fog. Hep C is a blood-borne virus. It is transmitted from person to person via blood-to-blood contact. An easy way to remember how Hep C is transmitted is by using what we call the ESSI principle. In order for Hep C to be passed from one person to another, infected blood needs to exit the bloodstream of the person with an active virus. Next, there needs to be a sufficient amount of infected blood present to transmit the virus. The infected blood then needs to survive in the environment, and then this blood needs to enter the bloodstream of another person. There are numerous risk factors to consider when thinking about how Hep C is transmitted. There are also many myths. Keeping in mind the ESSI principle, some high-risk situations include the sharing of injecting equipment. This includes not only the sharing of needles and syringes, but also spoons that drugs have been mixed up in, tourniquets, swabs, and even the surface that was used to prepare drugs for injection. Other common high-risk situations include sharing unsterile tattooing equipment, sharing body-piercing equipment, razor blades, and toothbrushes, to name a few. There are many myths as to how someone may become infected with Hep C. These examples highlight a few myths about Hep C transmission. Being bitten by a mosquito is not a mode of Hep C transmission, nor is sitting on a toilet seat. Shaking hands with someone is also not a way Hep C is passed from person to person. There is, however, a very low risk of Hep C transmission from mother to baby during birth, but this risk is very low, as is transmission via breastfeeding, unless the mother has cracked nipples and the baby is teething. So, how can you prevent getting or spreading Hep C? Do not share injecting equipment. This includes needles and syringes, tourniquets, filters, drug mixing containers, or any other equipment that may have traces of blood on them. Only use sterile equipment and facilities for tattooing and body piercings. Avoid getting a tattoo in jail. Injecting equipment should always be appropriately disposed of. Free disposal containers are available from your local needle and syringe program. You can also return your full containers to your local NSP so that they are appropriately disposed of. You should talk with your NSP worker on other disposal options if you find that you can't return them to your local NSP. All blood should be treated the same. Always clean up and cover wounds. It's important to know that there are different tests for the detection of Hep C. These can include Hep C antibody tests. An antibody test will tell you if you have ever been exposed to Hep C. It won't tell you if the virus is active or not though. If you've ever had Hep C, you'll always be antibody positive. A Hep C polymerase chain reaction test, or PCR for short, will determine whether or not you have an active Hep C infection. Other tests include a liver function test, or LFT. A liver function test is a blood test that measures the levels of several substances, including enzymes and proteins, that have been excreted by your liver. Levels that are higher or lower than normal can indicate liver problems. Fibroscans also assess your liver's health. Fibroscans determine the stiffness of your liver. This tells the medical professional the state of your liver and whether or not you need additional tests to determine liver health and any relevant treatment that may be required. The good news is that liver biopsies are no longer required. This is a relief to many people, as undergoing a liver biopsy can be a painful experience which resulted in many people not being treated in the past. If you feel that you may have been exposed to the Hep C virus, talk to your doctor, nurse, practitioner, or other healthcare worker about getting tested. Quinn now offers free rapid Hep C point-of-care testing, or POCT. Point-of-care testing is a type of PCR test and will determine whether or not you have an active Hep C virus. It's a quick and easy test that requires just a few drops of blood from a finger prick sample and in approximately 60 minutes will return a result. Contact your local Quinn office to book in your Hep C point-of-care test. Hep C treatments have come a long way. In 2016, new Hep C treatments were released in Australia. These treatments give people a 95% plus chance of cure. They have minimal side effects, often no side effects at all. Medication consists of pills for a duration of 8 to 12 weeks, but no injection like there was in past Hep C treatments. These medications are subsidised by the government, keeping them affordable, and treatment can be accessed by seeing your local nurse practitioner or GP. Those with advanced liver disease can still be treated, but may be required to attend a specialist liver clinic. So, who can access treatment for Hep C? Well, anyone with active Hep C virus can access treatment in Australia, though if you are under 18 years old, you'll just need a parent or guardian's permission. It is also important that you are not currently pregnant. Talk to your healthcare professional about treatment options for you. If you've done treatment before and have been reinfected, you can access treatment again, as many times as you need to. Most people who take the course of Hep C treatment are cured first go, even if you had liver cirrhosis. All new Hep C treatments are short in duration, between 8 and 12 weeks, and there are backup treatments if you were one of the unlucky few that was unable to clear the virus. Queensland Injectors Health Network, or QUIN for short, offers a hepatitis C treatment and management program. It is delivered across Queensland with telehealth options also available. The program offers a range of services. These include Hep C testing and treatment access, along with FibroScan access on-site, which helps determine the health of your liver. QUIN also provides support and education at all stages of treatment and can help out with access to harm reduction-based programs and other services and information as required, discuss reinfection and retreatment options, and even offer peer worker support to assist through treatment regimens if desired. Becoming reinfected with Hep C can and does happen, and that's why it's important to understand the high-risk situations that we discussed earlier. If you feel that you may have been exposed to Hep C after being treated, it is important to speak with your needle and syringe program worker or other healthcare professional and get tested. There's a lot of information available about hepatitis. If you need to talk with somebody about Hep C testing or treatment, contact Quinn on 1800 172 076 or Hepatitis Queensland on 1800 648 491 or Hepatitis Australia on 1800 437 222. And let's stay Hep C safe.